Hello everyone, I am Dr. SAIF RAHMAN Khan, third year resident in the Department of Radio Diagnosis IPGME at SSKM Kolkata. And my topic for discussion is evaluation of vesicle imaging, reporting and data system VI-RADS using MP-MRI for bladder cancer, a clinico-pathological correlation. Bladder cancer is amongst the most common malignancies worldwide and represents a significant cause of morbidity and mortality. Tumors are categorized into non-muscle invasive and invasive muscle invasive bladder cancer with prognosis and management depending upon the invasion of detrusor muscles. Accurate preoperative differentiation between the two is crucial for treatment planning. MP-MRI has emerged as a reliable non-invasive modality for the staging of bladder cancer and assessment of muscle invasion. The virus scoring system introduced in 2018 for standardized reporting of MP-MRI in bladder tumors. HP examination remains the gold standard to assess muscle invasiveness. VI-RADS score is derived from T2 weighted imaging, DWI, and dynamic contrast enhanced imaging. The primary aim of my study is to validate multiparametric MRI based VI-RADS score with detrusor muscle invasion vis-a-vis histopathological examination. And secondary objectives included determination of the VI-RADS score using MP-MRI, determination of agreement between MP-MRI based VI-RADS score with histopathological staging, and using MP-MRI based VI-RADS score as an imaging biomarker in bladder tumor stage. Study was started after taking permission from the institutional ethics committee. We did a prospective observational study in collaboration with the Department of Urology. We had 35 patients of bladder tumor who underwent 3 Tesla MRI pelvis using the standardized protocol, which included T2 weighted imaging, DWI, and DC sequences in the departmental GE Signa 3 Tesla MRI machine. We evaluated clinical parameters, which included age, gender, sign symptoms, CBC findings, USG findings, urea creatinine, and cystoscopy. And imaging parameters included T2 weighted imaging, dynamic contrast enhancement, and DWI imaging, and ADC value was calculated. So the flow study of the study was that we took the patient with the bladder solve which fulfilled the eligibility criteria, obtained their consent, and then we did baseline information recording, including blood and imaging reports, clinical history. We did a cystoscopic evaluation of them, and further they underwent MP-MRI and pilot scoring and ADC calculation was also done. After that, the patients underwent a routine TUR biopsy and HP reports were correlated. As an example, here we can see MRI imaging of a 6-year female patient who had a VI-RADS 1 sol having an HPE of non-invasive low-grade tumor. We can see an intermediate T2 signal intensity lesion. And on subsequent contrast enhanced study, there is enhancement of the tumor. There is early enhancement of the tumor. And on DWI, we can see a low to intermediate signal intensity with intermediate values on ADC. And there is no sign of muscle invasion on this. In contrast, here we have a 48-year-old male patient with VI-RADS 5 sol having an HPE diagnosis of invasive high-grade tumor. We can see that there is a polypoidal extension of the mass beyond the muscularis propria into the perivesical fat plane, showing peripheral contrast enhancement. And even on DWI and ADC study, we can see there is interruption of the muscularis propria hypointense line, and there is high signal on DWI and corresponding low signal on ADC, signifying a diffusion restriction by the tumor. Baseline demographic and clinical features of the 35 patients, we had 29 were males while 6 were females. Median age was 60. All patients had hematuria and 31% patients had a history of smoking. We also had the clinical parameters correlated. A median VI-RADS score was 4, while a width of 21 had non-muscle invasive, while 14 had muscle invasive bladder tumor, and low to high grade tumor ratio was 16:19. ROC curve analysis showed a strong agreement between the VI-RADS score with HPE staging. And when we chose a cutoff value of 3 of VI-RADS score, we had a sensitivity of 93% and specificity of 75%. Even Cohen's kappa value was 0.66, indicating a substantial agreement with HPE values. VI-RADS score was a predictor of tumor invasion and grade, with high-grade tumors having higher VI-RADS score. Logistical regression analysis revealed VI-RADS score as an independent, sorry, predictor of muscle invasiveness, and it was noted that tumors with sessile and polypoidal morphology had higher VI-RADS score. Higher grade tumors had lower ADC values, and when chosen as a cutoff value, 0.953 into 10 raised to the power minus 3 millimeter square per second, there was a moderate diagnostic performance of the ADC value to choose between high and low grade tumors. Not only the VI-RADS score as a whole, but even its individual components had significant efficacy to determine muscle invasiveness. As we can see, all these curves almost coincide with each other. So our study demonstrated a good diagnostic accuracy of VI-RADS scoring to predict detrusor muscle invasion. The findings are comparable with other studies that had predicted VI-RADS score as a it had predicted VI-RADS score in detecting the muscle invasion. Both VI-RADS score and ADC values are imaging marker of tumor grades, and significantly higher VI-RADS score was found in sessile variety as compared to other morphological variants. And VI-RADS score correlates with tumor grade, and ADC values provided additional supporting tumor characterization. Limitations included relatively small sample size and a single center study, and lack of inter-observer variability analysis. In conclusion, we can say that VI-RADS score shows a very strong agreement with histopathological staging. ADC values are reflective of tumor grade. Individual components of the VI-RADS score are effective to differentiate between muscle invasiveness versus invasive bladder tumors. VI-RADS score significantly differs between the morphological variants of the tumors, and thus VI-RADS score is a useful non-invasive imaging biomarker of bladder tumor invasiveness, grades, and morphology. Thank you.